So most people think heart disease starts in the heart, but the truth is it starts in the highways that feed it. So your arteries aren't pipes. They're living, intelligent tissues that talk to the rest of your body, and when they get damaged, everything downstream suffers. So inside every artery is a very, very thin, small layer called the endothelium. You could think of it as the skin on the inside of a blood vessel. It senses stress, regulates blood flow, and keeps inflammation calm. So when that layer gets injured, and this can be by many things, high blood sugar, toxins, oxidative stress, sleep deprivation, high blood pressure, it can become leaky. Cholesterol slips in, sticks, and oxidizes, and that's when your immune system rushes in like construction workers, except they overbuild. Platelets start to pile up, forming a clot or even to the extent of a blockage. It's like a pothole that keeps being patched instead of repaved over and over and over and over, building up more and more and more until the traffic finally stops. This process can literally take years silently before the first symptoms appear, and those symptoms are heart attacks and strokes. I've seen patients with perfect cholesterol, perfect EKGs, perfect stress tests on paper, but raging endothelial inflammation in reality. So don't wait for symptoms. Test for vascular inflammation and oxidative stress early. Support the endothelium. Now, there's a million ways to do it. I'll give you some tips at the end, and actually a course that we talked about it in some great depth. But simply, colorful fruits and vegetables are very helpful. Those are high in antioxidants. Anything high in antioxidants are going to be beneficial. Stress management, high quality sleep, movement daily, maintaining blood sugar and blood pressure. So high level, there's lots that can damage this vascular endothelium, and you really need to know what you need to do that's going to have the best outcome. But it's very important to remember that the goal isn't to lower cholesterol. It's not a goal. In fact, I have a family friend that had a clean bill of health one day, and it was within 3 days later, and this was a cardiovascular checkup because he did have risk of cardiovascular issues, and they had their repeated checkups, but it was the simple tests and the simple evaluation, and then he had a heart attack the next day. And he's not an isolated case. Many people have a clean bill of health and then they have a heart attack, and it can be fatal. It's because they're not addressing these deeper root causes. So don't chase cholesterol. People with perfect cholesterol pass every day from heart attacks, and there's other things to it. Pay attention to the healthier, getting the wall of your vessel healthy. And if you want more ways to protect your vascular health naturally, follow along. I'm going to keep adding more, but there's an entire health course, heart health course specifically, I created with my colleague, and it walks through everything from lab tests to supplements to dietary strategies to what to ask your doctor to what to do on your own, symptoms to pay attention to, and it's in a step-by-step fashion. It's never been release free, ever. It's being release free now. I don't know how long it's going to be up there, but it's going to be in the link. So click it. Hopefully you can get a copy of it. With that being said, I'm Dr. Glenn Harrison. I look forward to talking to you in the next one, and we'll talk about the root causes of other health-related problems.